Today, I want to talk about a technique called reverse pressure softening that can be very helpful during the early stages of breastfeeding and can help to relieve breast engorgement. Hey, it's Morgan, and welcome to the Passable Parent channel. Before getting started, don't forget to like, subscribe, and turn notifications on so you don't miss out on any future videos. Thank you so much for your support, and I hope these videos are helpful. And if you have any questions for me, make sure to comment down below. I love to help in any way I can. Breast engorgement is a common problem that new moms face when they start breastfeeding. It really caught me off guard, even with my years of experience, how engorged my breasts were in the beginning. It happens when your breasts become overly full and hard, making it difficult for your baby to latch onto the areola. When this happens, it can be really painful and frustrating for both you and your baby. This technique, reverse pressure softening, that I'm going to be teaching you in this video can be especially helpful during the first week or two of breastfeeding when engorgement is the most common. Reverse pressure softening is a technique that can help you to soften the areola so that your baby can latch on more easily. I'm going to be using my little model that I have of a breast, and unfortunately, the world we live in, I have to have the nipple of it blurred for all of you because YouTube doesn't like nipples unless they're on a man's chest. This we can pretend is a man's chest, but YouTube will probably still give me a strike. But I want to make sure all of you can learn how to do this because this is so important for you to know how to do, because breast engorgement can be incredibly painful. I've been there, I get it. I'm going to use my model to show you the technique. And the technique involves gentle pressure around the areola, push some of the fluid away from the nipple, allowing it to soften and become more pliable and easier to fit into your baby's mouth. This not only can help your baby latch on more easily, but it also can reduce any pain or discomfort that you may be experiencing. And when your breasts are really engorged in the beginning, you might also need to pump. So with my breast engorgement, it was really difficult to even fit my breast and my nipple into a breast pump. This reverse pressure softening really helped me be able to get the nipple into the pump because I had no choice but to pump. So again, it's supply and demand. So it's kind of like if you have to pump, you might be increasing milk production, but you need to pump to relieve the pressure in your breast. So it's kind of a catch-22. But it's a necessary evil. And on the positive, you will help start building that freezer stash. Another tip that I have for you is when you're still in the hospital, if you're dealing with this breast engorgement, if your milk comes in while you're still in the hospital after you give birth, ask for a breast pump. They can bring you a hospital grade breast pump right to your bedside. And even if you don't have this breast engorgement and your milk is not coming in yet, you can actually help stimulate that milk to come in, stimulate that milk production. If you ask for a breast pump to be brought to your bedside, you can start pumping, and that will help with the milk production. There's different recommendations about when to start pumping, but from my personal experience and experience of my friends, it was not too soon to start and to start building that freezer stash. And you never know what might happen, when you might need to be away from baby, or if you're returning to work. So I highly recommend asking for a breast pump while you're still in the hospital. So getting into the technique. First, you're going to start by using your fingertips to gently massage the outer edges of the areola. This will help to push the milk towards the nipple. You're going to just take your fingers and just push towards the nipple very gently. This will help to soften the tissue around the nipple because with engorgement, it's going to be very hard and swollen. So apply that gentle pressure around the areola with your fingers, but avoid pressing directly onto the nipple. You can also use a cold compress or ice pack to help reduce that swelling before performing this reverse pressure softening. You can use a silicone breast pump like the Haakaa pump to apply gentle suction to the breast, and this will actually help to draw out the milk and relieve some of the pressure. You also can take a warm shower or apply a warm compress to your breast. This will help to increase the blood flow and relieve some of the pressure. Drinking diuretic foods such as green tea, lemon water, watermelon, or cucumber can also help reduce that swelling. And remember, if you are experiencing severe pain or discomfort, it's always a good idea to speak to a lactation consultant or your healthcare provider for additional support. So breast massage, hand expression, which is just expressing the breast gently to get the milk out. You kind of want to squeeze, not the nipple, but right near the areola of your breast to gently squeeze some milk out. And gentle pumping are all very helpful techniques that can be used in conjunction with this reverse pressure softening to help relieve that engorgement. These techniques can help to stimulate milk flow and prevent blockages, which can lead to more serious issues. So again, that reverse pressure softening, you kind of take your hand like this, open, and you just sort of you don't touch the nipple, but around the nipple, around your areola, and you just gently press. It's almost like when you're so engorged, your nipple is sort of like swollen and all sticking out maybe, and you can't really tell, like, maybe your nipple's getting inverted, which means it's like pushed in or sunken in. So you're kind of just using your hand to just push, so that way it pushes back the skin and the areola around your breast, so that way the nipple can protrude back forward because it might be depressed. So that reverse pressure softening is just taking your hand like this and just gently pressing, like as much as you can tolerate, inward to help get that nipple and that areola back out. But don't press on the nipple because your nipples are very sensitive, and you just kind of take that hand and you just gently push all around. And that is a simple technique that many moms don't know about to help with that engorgement. All you're doing is just taking your hand like this and just gently pushing. And I'm sorry that I have to blur out this model, but you know how it is. If we say it's a breast or a woman's, then we got to cover it up. So I hope that you can see through the blur what I'm talking about. So that's reverse pressure softening and some other helpful tips for you. And also vibration is another great tip for you. So using a massager, they sell some lactation massagers, an electric toothbrush. These are all great ways to sort of also help with that engorgement. So just take that and move it around your breast to sort of gently massage with that vibration. And that also can really help with engorgement. So again, I hope this video was helpful and informative for you and all you moms out there. And I hope that you could see what I mean by reverse pressure softening and give it a try. I'm so sorry if you're in pain or discomfort right now. Don't forget to like and subscribe to the channel for more helpful tips and advice on breastfeeding and parenting. And I certainly hope that your engorgement relieves soon for you. Thank you so much for watching. I appreciate your support, and I'll see you in the next video.